Okay, so I got cut off with the first video, so let's finish talking about this and welcome Rory to the video. So some other brain abnormalities that a person with schizophrenia might have is that we have these fluid-filled ventricles in the middle of our brain. On a normal patient, they're small, but it's shaped like a butterfly. On patients with or in patients with schizophrenia, there is an enlargement of those ventricles. We're not really sure what those ventricles are for or what they do, but we know that this is a characteristic of someone suffering from schizophrenia. Other things that happen in a patient with schizophrenia is that they have an abnormally low activity in the frontal lobes. There's too much activity in the thalamus that creates those hallucinations. Remember, the thalamus is the gateway for our sensory information. There is a shrinkage of the hippocampus and the amygdala. And the greater the shrinkage, the worse the disorder. And that makes sense, right? Because our amygdala is controlling those fear reactions. And if the thalamus is small, the greater the difficulty in filtering information and then possibly reacting in the correct manner. So why do these brain abnormalities occur? Well, it could be possibly due to prenatal problems. Low birth weight, birth complications, infections that the mother might have during pregnancy, especially influenza, right in the middle of pregnancy. These are all characteristics that we have seen repeated in people with schizophrenia. Also, there's genetic factors. This is the nature side of things. So the prenatal issues are the nurture, the genetic factors are the nature, and the likelihood of individuals suffering from schizophrenia is 50% greater if their identical twin has the disease. Now, this does not mean that identical twins are 50% more likely to develop schizophrenia. No, this means that an identical twin who has schizophrenia, their twin is 50% more likely to develop the disorder as well. Some early warning signs of schizophrenia include a mother with long-lasting schizophrenia. We know there's a genetic factor, hereditary there. Birth complications, oxygen deprivation and low birth weight, a short attention span, and poor muscle coordination, disruptive and withdrawn behavior, emotional unpredictability, and then poor peer relations and solo play. Great, this wraps it up for schizophrenia. We'll continue with our next disorder in the next video.